I Promise School in Akron has gained national attention because it was founded by basketball great LeBron James. The school is known for its inventive classroom techniques.
So they're going to take a selfie of themselves and then make their own talking bubble.
But right next door, the Akron School District has also been trying to innovate.
While I'm here, can you look at my ears, actually?
Sure.
Akron Schools opened this on-site healthcare clinic for school employees and their families. School administrator Keith Lichty Clifford says he's been coming here since it opened about a year ago.
All right, looks good.
Looks good.
It's optional for district employees. They have traditional health insurance and can go to other doctors, but
It has just been so convenient for me because I work in the office building right next door.
Dr. Kevin Wong says this is not an urgent care. He calls it direct primary care. Since there's a small targeted group of patients, it's easy to get same-day appointments and everything is free, including prescriptions.
But here, there's nothing out of pocket, so it's like a win-win.
Dr. Wong says all patients have an initial 1-hour appointment to go over their medical history before they get sick. And he's not under any pressure to keep visits to 15 minutes when they come in with issues. And many have his cell number for after hours or weekends.
And I would tell them, don't be shy to call. If you're thinking about going to the ER or urgent care, that's when you need to call.
That's the goal for Akron school officials, keeping their employees from using more expensive places for basic care, like hospital emergency rooms and urgent cares. School districts and small businesses, faced with ever-rising healthcare costs, are turning to new models like this to cut costs, says Akron Schools Chief Financial Officer Ryan Pendleton.
It's a major expenditure, and it tends to grow faster with inflation than any other part of our budget.
Pendleton says Akron Schools contracted with the Denver-based Paladina Health. Paladina operates 8 other clinics for businesses in Northeast Ohio, including the Lincoln Electric Company. But Akron is the first school district with one of their clinics on the school grounds.
We put about $1 million into this investment up front, but we're just past a break even. I think we've publicly talked about maybe returning about $300,000 above that first year $1 million investment to our coffers.
Hi, Jacinta. How are you?
Hi, how are you?
Good. I'm here for my appointment with Nancy.
The Mayfield School District, just outside of Cleveland, has also turned to providing direct care for its employees. The clinic on the Mayfield High School campus is a partnership with Cleveland Clinic and is staffed by a physician assistant 3 days a week.
Hi, Nancy. How are you?
Good to see you.
You as well.
If by chance I was to order some kind of testing, like an x-ray or blood work, if I had to send it out, that would be billed to their insurance. But anything we do on site, including immunizations, are free.
Carla Specia, who works in the high school office, says some of her coworkers don't use the clinic because they already have a family doctor. Others, she says, are resistant to change. But the clinic has been a godsend for her and her family, she says.
Back in the day, when you had one doctor that saw you for everything. And now the medical field has changed dramatically and you've got doctors for every tiny little thing. So she knows me, she knows my family.
Mayfield School Treasurer Scott Snyder says the clinic is used by some 550 employees and their family members, and it has helped employees and the school district control health costs.
We are seeing about a 6% reduction year over year on our overall health insurance costs. We're about $11 million spend in prescriptions and routine medical claims.
Escalating healthcare costs are impacting schools and businesses every day, says Baldwin Wallace University professor Thomas Campanella. Campanella, who researches healthcare finance, says this trend of businesses becoming more proactive and opening their own primary health clinics started several years ago and is blossoming across the country because they save money but also keep employees healthy.
But also from an employer standpoint, the other advantage is that when they're healthy, they're showing up for work, so there's less absenteeism. When they're healthy, they're more productive. I have a bad back and that now all of a sudden I'm proactively addressing that through exercise or whatever. So then all of a sudden they're more efficient at work, so the employer benefits that way.
Carla Specia agrees that the clinic has helped her stay healthy. The fact that she and the teachers at the high school can pop over to the clinic during lunch or before school encourages them to come to work, even on days they're not feeling their best. Marlene Harris Taylor reporting for IdeaStream.